So next topic is adulthood. So we have three periods of our three phases of adulthood. We have the early, the middle, and the late adulthood. Early begins from 20 to 40 and ends in 40. Middle age is 40 to 60, and we have late adulthood, which is 60 until death. So in other countries, they have emerging adulthood, which is earlier than the usual, which starts from 18 and it ends late, which is 25. Early young adulthood begins in late 20s and it lasts through 40 years of age. And in this time, you are establishing personal and economic independence. You're exploring, especially in love and work, instability, self-focus, and feeling in between. Because this time your uh, psychosocial stage is intimacy versus isolation. So you're intimate to everything. You're intimate with love, relationship, relationship, work, career, and your family and friends. So physical development, usually you're healthy, you don't have any physical problems or medical problems at this time. Change as a result of diet, exercise, pregnancy, and lactation. So this time also you're getting married, you're having children, so pregnancy is expected. So these are some physical changes that is happening to you, most especially in female, which is pregnancy. So what are those changes that happen to them? So these are the list. And for men. So for their cognitive development is formal operational stage. So as I've told you, it's intimacy versus isolation. Then at this time, you're becoming a parent. So advantage of having children early, if you're having early pregnancy or uh, early pregnancy, what are the things or advantages that you are having? First is parents are likely to have more physical energy. So you can jive with your children because you have still uh, energy. You are physically fit compared to those parents who have their child late. Then mother is likely to have fewer medical problems with pregnancy, so complications are less. Then parents may be less likely to build up expectations for their children. But the exception is if you're having children at the age of 14 years old or below, it's very risky to have them because their reproductive system is still underdeveloped. So there will be lots of complications. Advantage, if you're having child later, parents will have had more time to consider life goals. Parents will be more mature and will benefit from their life experiences. Parents will be better established in their careers and typically have more income. So you're well established, so you can give a good future to your children compared when you're getting pregnant or having baby in early early days or early years of your life. Then you are intimate also with your friends. So the focus of adult friendship is someone different from men and women. So for female, they confide in one another about their feelings, their problems, and their interpersonal relationships. Usually what they are having problems, encountering their problems for their family, for their work, they are all telling this to their female friends. While male minimizes discussions, they avoid discussions about relationships or personal feelings or problems. Instead, tend to do things together that they find mutually interesting. So, for example, they're going for a bike, motorcycle ride, or what else? Bowling. So these are the things, but they minimize discussions about their personal things. Then health promotion guidelines for this. So as early as uh, young adulthood, usually 40 years old, uh, you can have screening if you have any diseases like mammography or other diseases, a screening for diseases. So testicular self-examination, pap smear, you can do this at this time. Next stage is middle adulthood. So this will be 40 to 60 years of age. This is the time for expanding personal and social development, involvement, and responsibility. So you're getting or you're preparing for establishing a legacy to the next generation. So this is mainly what you are going to do. Then assisting next generation in becoming competent, mature individuals, reaching and maintaining satisfaction in a career. So at this time, you're so stable. Maybe you're a boss already in your company, you're a supervisor, you're the director of the company or the CEO. So balancing work and relationships, then reassessment of life priorities. So these are the things that you're encountering in your middle age adulthood, mostly in your physical changes, especially joint stiffness and difficulty movement. Why? Because they are having arthritis already, starting to develop arthritis. And at the after age of 55, they are having this menopause. Then they're having problem with their bones. So because of the bone loss, especially if you had this menopause, you will feel everything, and then many diseases will start if you already have your menopausal stage. Then muscle strength and stamina may begin to decline. Hair may begin to turn gray and thin. Wrinkles appear in skin. Chronic health problems like hypertension, heart disease, and diabetes may develop. So these are the changes that is happening to you in your middle age. So as nursing assistant, you need to provide an education for them to decrease this, to cope with these changes. So these are the lists, just read it. Then according to Piaget, these are the psychosocial development of this middle-aged adult, which is the generativity versus stagnation. Okay, adults who have achieved generativity feels good about their lives and comfortable with others. So you feel that you succeeded all aspects of your lives, becoming more involved in altruistic activities like community involvement, volunteering work. So that is the activities that you're involving yourself. Then usually experiencing changing family roles, caregiver to aging parents, and then grandparents. Stagnation is like when you feel stagnant, you're not moving. I'm already 40 to 50 years old, but still I'm an employee. Okay, but my classmate, when I was elementary, he is already the boss of the company. So that is stagnation. So we should be on the positive side, which is the generativity. So some visual problems may arise, like presbyopia. Presbyopia is the problem in your eyes, wherein long-sightedness caused by long loss of elasticity of the lens of the eyes. Then we have also presbycusis. It is the primary sort of loss is for sound of high pitch, a problem called presbycusis. So starting age about age 45 onwards, the period known as the female climacteric, or the transition from being able to bear children to being unable to do so. Okay, so notable sign that you will be having menopausal or menopause or cessation of menstruation. So we have different symptoms during menopausal, we have hot flashes or feeling always hot, okay, even if it's cold. Headaches, we feel dizzy. Heart palpitations and aching joints are common during menopausal. So these are the things that you will feel. For male climacteric, they are calling it andropause. For the female, it's menopause. For the male, it's andropause. The period of physical and psychological change relating to male reproductive system that occurs during late middle age. The most common is the enlargement of the prostate. So during your 40 years of age onwards, you need to check or you need to screen if you're having prostate gland enlargement, because the possible because of andropause, it will be enlarged. And if it will be enlarged, you're at risk for having prostate cancer or BPH, benign prostatic hypertrophy. Then symptoms are problems with urination, you have difficulty urinating, then you have pain during urinating. So maybe these are the signs that you are having prostate gland enlargement. Then the man can still produce sperm and can father children through middle age. Okay, even 99 years old, you can produce sperm and he can produce offspring. Unlike female cannot produce child after menopause, but male can produce even if it's in older days. Then the cognitive development, they are having crystallized and fluid intelligence. So you may when we're talking about crystallized intelligence, it is the acquired store of information, skills, and strategies. It increases in adulthood, while fluid intelligence, it is the ability to deal with new situations. At this time, it will be decline. So generativity versus stagnation, as I've told you. So what are the care that you need to give for middle age? First is adequate rest. Okay, why? Because in these days, you can have andropause, menopausal, you can have problems, developing medical problems like diabetes, hypertension. You need to have adequate rest. Then the need for social contact continues. Stress management techniques, especially if your child is leaving you just to have is for marriage, to 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 separate their family to you, so you'll have stress as a parent. Then regular health and dental checkups should continue. Okay, nutrition also is very important, especially if you're having medical problems. You need to encourage them to follow the nutritional requirement that the doctor ordered for them. Then exercise and weight control. Okay, especially if you're having diabetes and hypertension, you need to control your weight, and you need to do physical activities. Then substance abuse prevention, stress management, recommendations for health screening like cholesterol screening, prostate examination, mammography, and pap smear. So last stage is the late adulthood, which starts from 60 onwards. Late adulthood is the time when you're adjusting to retirement, decreasing strength and health, new social roles, reviewing one's life. So it's for them, it's the psychosocial stage is psychosocial stage for them is according to it's ego integrity versus despair. So we as nursing assistant, we are planning to go to US, are planning to go to UK, we're planning to go to Canada. Most of our patients are late adult patients or late adulthood patients. So we should be particular, or we should familiarize ourselves on the care that we need to give to the patient. So we need to know what are the changes that they are having during late stage and what are the things that we can contribute for their care. So these are the changes in their integumentary or skin. Mostly their skin became less elastic and dry. Okay, and it's easy to be bruised. So as nursing assistant, we should use mild soap. We bath oils or lanolin lotion. We should give lotion, put lotion, then bath and shower once or twice a week. Why? Because they have less fats already. They are old, so they will feel more cold. So we should give them bath twice a week. Then we should brush their hair daily, shampoo as often as needed for cleanliness and comfort. Care for sore and injuries immediately, because if any pressure injury started, it's very difficult to treat because they are old already. So we should prevent to make the things worse. Then socks, sweaters, and laps. They are very easy to feel cold. That's why you need to put socks, sweaters, and blankets. Then circulatory changes, most of them, they have the heart function is decreasing and deteriorating. So what are the things you need to do? So first is you need to avoid strenuous exercise or overexertion. Simple walking or brisk walking is enough for them. Then periods of rest. Of course, they need to have rest. They are old, and maybe if they don't have rest, maybe heart attack may happen. Moderate exercise, prevent the formation of blood clots. Okay, we should always do exercise to prevent blood clots. Support stockings or anti-embolic stockings. Do not wear garters or tight bands around legs. And if confined to bed, range of motion exercises or turning every 2 hours. If your patient is having high blood pressure, what is the diet needed? You need to give them a high, low salt, low fat diet. Then, exercise as recommended by the physician. You need to monitor always their vital signs, especially their blood pressure. Then, exercise, watch for orthostasis or orthostatic hypertension. Why? Because you're giving antihypertensive medication. So, it will make the BP drop. So, orthostatic hypertension might happen. So, you should watch. You should always tell or instruct the patient to slow down in changing his or her position. Then, dependent edema is common. So there is a swelling in the legs or arms. But pitting edema is not normal. Assess smoking exposure to environmental pollutants. Help with stress management, especially at this stage. Many of the late adulthood patients, they are so depressed, especially if they don't have family with them, they will feel depressed. Then, so your psychological support is very important for them. Then help maintain weight and nutrition. Then respiratory changes. The changes respiratory changes, it's uh, also happening. Oh, ba't niya yata? Respiratory change happening. So again, respiratory changes for most late adulthood patients, they are having decreased function of respiratory system, which always exhibits difficulty of breathing. Okay, difficulty of breathing because of chronic diseases that they have in their respiratory system. So what are the things we need to do? First is we need to provide rest periods. Then to give a proper alignment of the body, and proper positioning. If your patient is having difficulty breathing, so you should position your patient into semi-Fowler's or high Fowler's position. Then use 2 to 3 pillows. Of course, your patient is having difficulty of breathing, so you provide 2 to 3 pillows because making him flat will uh, worsen the problem. Then avoid polluted air. Breathe deeply and cough frequently, so their lungs will be re-expanding. Then may need continuous oxygen therapy, especially if they're having COPD or chronic obstructive pulmonary disease. This condition requires oxygen therapy, continuous oxygen therapy. Next is, what are the nervous system changes of old age or late adulthood? So of course, these changes has something to do with decreased function of their brain cells. So most of them, they are forgetting things. Most of them, they are interfering with the thinking, interpreting, reacting, and also remembering because of the decreased number of neurons, the size of the brain become reduced, and then there is a decreased neurotransmitters. Neurotransmitters is a chemical messenger of the brain, okay, to do certain processes in our body. So what are those care that we can provide to our patient to cope with these changes? First is you assess the gait and balance because at this time your patient is prone for fall. So use walking aids like uh, cane, what else? And other walking aids that I taught you before. Then inspect feet daily. Use caution with heat cold applications because at this time they have less sensation, so they will not feel if it's too much heat and too much hot or too much cold. Then orient frequently. Okay, you always orient the patient, especially those patients with Alzheimer's disease or dementia, with time, date, name, place. Okay, time, place, and name. Okay. Hi, sir. I'm your nursing assistant, and you're Mr. Uh, Clinton. And then you're in the hospital, and at this time it's morning. So you should always orient, especially those patients who is not remembering. Provide social engagement. Use principles of patient education. Significant memory loss is not normal. Then, what are the changes in sensory? They have decreased function of taste, smell, vision, and hearing. So they will have problems in reading, hearing, impairment. So there is also a risk of fall because of visual problems, hearing problems. They will have some complications. So what are the things we need to do? This one. They are more susceptible to burns because they cannot feel frostbite, cuts, fractures, and muscle strains. So what are the things we need to do for sensory? Ensure good lighting for reading, safe mobility and function, provide large font print and high contrast. Use block style printing and avoid cursive. Ensure patients' class are within reach. Always remember this because these are their artificial eyes. Then suggest using a magnifier for small print and difficulty reading. For hearing, assess for hearing prior to speaking. Then hearing assistive devices like hearing aids. Lower the pitch tone of your voice. It should be slow, moderate tone. Don't shout the patient because he will hear you and he will be angry to you. So use a soft, moderate tone voice. Moderate tone voice, I mean. Then speak directly to the older adult facing them. Okay, don't speak on their back because the problem they will be surprised. Then reduce background noise if you're talking to them, because it will add to the difficulty perceiving what you are going to say. Then digestive changes. What are the things? What are the changes? Usually they're having constipation because of decreased peristalsis or movement of food to the stomach, to the intestines. They have difficulty swallowing. So these are the major changes. So what are you going to do? You provide good oral hygiene, repair or replace damaged teeth. You use artificial teeth so they can eat uh, enough. Then relax eating as atmosphere, high fiber, high protein foods with different tastes and textures, seasoning to improve taste, but be careful with the seasoning if your patient is hypertensive, okay, because it will be more salty and it will increase the condition. Increase fluid intake, okay, so to make the bulk or the to prevent constipation. Then urinary changes, mostly because of decreased kidney function. They have incontinence. They cannot control their uh, urine. Then you need to increase fluid intake for them. Decrease the fluid intake before bedtime, so they will not have incontinence during night or nocturia. Then regular trips to bathroom. Okay, usually every 2 hours, you should assist them to go into washroom so they will not wet the bed. Then easy to remove clothing. Okay, don't put any tight fitting clothing to these patients. Absorbent pads, review physical exams and history, prevent dehydration. Monitor need to adjust doses of medication and prevent incontinence. For endocrine changes, they have problem with and glucose. Most of them, they are diabetics. Okay, they are lacking or decrease or insufficient amount of insulin. Okay, they're calling it insulin, the one who is controlling or decreasing the amount of glucose in your blood. Shrinking thyroid gland, so that's why you'll see they have hyperthyroidism or hypothyroidism. And decreased melatonin. Melatonin is the hormones for sleep. That's why they are having difficulty sleeping. So what are the things you need to do? Proper exercise, adequate rest, medical care, balanced diet, healthy lifestyle, monitor for diabetes, monitor for electrolyte imbalance, promote useful sleep, and avoid interruptions. For reproductive system, most of them, they have uh, decrease for female, they have decreased vaginal secretions, then thinning of vaginal wall. Mostly if they are having menopause, they will feel this changes. Then for male, decreased testosterone. So reproductive care, understand physical and psychological needs, sexual needs, allow married couples to be in the same room. Then give privacy to consenting elderly. The psychosocial, as I've told you, is ego integrity versus despair. Ego integrity is like they are reviewing their life, and when they reviewed their life, I did good in my life. I did something in my life that helps people, that makes people happy. So you're not disappointed. Unlike despair, this is the depression. Okay, so we should be in the ego integrity, not on the despair. That's why you are very in demand in home care, because most of them are in on despair, because maybe they did something, they have regrets in their life, bitterness. Okay, that's why they are depressed. When you're in ego integrity, you'll notice your grandparents, they are always telling you, oh, when I was younger, I was a pilot. When I was younger, I was a nurse also. When I was younger, I was a soldier. So these are the things that they are reviewing in their lives. Then emptiness syndrome. Emptiness syndrome is declines in marital satisfaction after the children leave the home. So this is also one cause of their depression when their children leave them to create their new family, a new family without them. Psychosocial changes that they are having are fears of sick person, death, chronic illnesses, loss of function, and pain, and dealing with fears created by illness. So first, they are having confusion and disorientation. So causes are stress, any medical problems, mostly medical problems. And usually, confusion is temporary. Unlike Alzheimer's, it's permanent. If we're having this Alzheimer's, so there's no cure for Alzheimer's. While confusion, it's a temporary thing. Dementia, it is a loss of mental ability characterized by a decrease in intellectual ability, loss of memory, impaired judgment, personality changes, and disorientation. So usually dementia can be acute and it can be chronic when it became Alzheimer's. So dementia is reversible. It means it will go to its normal function or to its normal condition, while Alzheimer's is irreversible. You cannot return it to normal functioning. It means it's already there. You cannot remove it. So that's Alzheimer's. So it's very difficult for you, nursing assistant, or children to have a parent who is having Alzheimer's disease. So early stages, he has memory loss, depression, mood and personality changes, poor judgment, inability to plan and follow through with ideals. Middle stages, nighttime restlessness, weight fluctuates, paranoia, full-time supervision needed. Late stage, this is where hallucination is coming. They are seeing, they are hearing things that is not real. So this is the worst stage. So what are the things that we need to do if we're caring for this? By the way, Alzheimer's patients are in demand in US. So many patients, they are having Alzheimer's. So you need to familiarize yourself in taking care of patients with Alzheimer's. So first, you need to provide them a safe and secure environment, especially if they are in the late stage of Alzheimer's. They are hearing many voices. They are seeing any people which is not real. Okay, you should provide them a safe and secure environment. Then, avoid loud noises. Why? Because they will become more paranoid. And always orient them, or reality orientation, orient them with the person, time, and place. Hi, Mr. Clinton, I'm your nursing assistant. Your name is Mr. Clinton. You're in the hospital, and the time today is 9 a.m. Always orient. Then keep individual oriented to day and night cycles. Regular clothes during the day, open curtains during the day, so they will know it's day and this time is night. Pajamas at night. Speak slowly, clearly, ask clear and simple questions. Never rush or hurry the individual. Repeat instructions patiently. Encourage conversations about familiar things or current events. Encourage use of televisions and radio without overstimulating them. Be sure you use in sensory aids. If they are having hearing problem or visual problem, you use it aids. Then keep familiar objects in view. Avoid moving furniture and belongings, because if you change the position of the furniture, okay, they will become more confused. Then do not agree with incoherent statements. If they are telling you, I'm hearing voices, you don't answer, yes, I hear it also. But your response is, I'm not hearing voices at this moment. Then do not hesitate to touch, communicate with person, avoid arguments, encourage independence, and help self-help when possible. So as I've told you, if they are not having this integrity, they can have depression. Depression is one of the more common problems characterized by intense sadness and hopelessness. May be result of cumulative losses in life. Women show more depression at 50 and 60, but depression in men increases in age 60 to 80. So let's go with Parkinson's. Parkinson's disease is a chronic progressive disease characterized by muscle tremors, slowing of movement, and facial paralysis. So signs and symptoms of Parkinson's, you will also see a lot of Parkinson's disease in US and Canada and UK. Most of them are in that country. So they have stoop posture, back rigidity, flex elbows, tremors in the legs, mask face. Mask face means it's like their face is not changing. If they're happy, if they're sad, it's all same. Then forward tilt or trunk, reduce arm swing, hand tremor, slightly flex hip and knees, and shuffling short step gait. So what are the interventions that we need to give them? Independence in their adequate uh, ADLs, or what's this? Daily living. What is E? I forgot. Adequate daily living. Avoid social withdrawal. Involve in work. Okay, uh don't keep them always in the room because they will feel more depressed. So involve them in any social activities, okay, to have diversion. Then avoid embarrassment while eating. Okay, why? Because they have tremors, so they will have difficulty eating. So you use straws, wipe drools, use beam, then keep clothing cleanse, use large handle grips. Then it should be soft diet because the later part they will have difficulty swallowing, so maybe choking might happen, so it should be soft diet. Then daily walking safety, avoid fatigue, physical speech and occupational therapy, and avoid constipation, so should give stool softener. So that ends our discussion about adulthood care. Thank you.